over 70 years, antimicrobials have been expended to eradicate and inhibit growth of microorganisms that cause disease and infections. However, it was found that in a large margin of cases, microorganisms have instituted a way to provocate or resist the antimicrobial agent. Hence, antibiotic resistance is a substantial worldwide problem of aggregating magnitude and stands as a relentless global public health epidemic. There are several major impacts on the epidemic of antimicrobial resistance. This can include lengthier periods of illnesses as well as higher mortality rates for the community. Hence, this may lead to the necessary indispensable procedure of very costly and expensive drugs. Not only will this instigate a severe burden on the health system, but will also have a colossal impact on the economy. This will also cause an impediment in technological advances within the medical sector. Although the development of antibiotic resistance cannot be stopped, it is a global problem that must be addressed. In human health, infections due to antimicrobial resistance, or AMRs, provoke the need for lengthier hospital stays and expensive treatments, with an overall increase in mortality rates. The lack of effective antimicrobials diminish the impact of successful modern medical procedures. AMR infections in animals lead to reduced animal health, welfare, biosecurity, and production. More importantly, this type of AMR infection fronts a mean for transfer of resistant bacteria to people coming into contact with such animals. 2 million people have been infected with bacterial resistance, with at least 23,000 deaths per annum, which were a direct effect of these infections in the United States alone. However, antimicrobial resistance is present in all parts of the world, most commonly within the hospital and other healthcare settings. Carbapenem-resistant Enterobacteriaceae are difficult to treat due to very high levels of resistance to approximately almost all antibiotics. A case study on this had found up to 50% of patients with this infection in their peripheral bloodstream resulted in death, marking this as a serious matter. Another form of Enterobacteriaceae growth with resistance to antibiotics is the vancomycin-resistant Enterococci, or VRE. In Australia, 15 confirmed isolates of VRE spread from 13 different strain types, with the first isolated found in 1994. The spread of VRE outbreaks had increased to over 20 times of that in 1980. Reports also demonstrated a 23% and 15% increase of infection rates in hospitals, specifically the intensive care and the non-intensive wards respectively. Carbapenems are an important antimicrobial class for the treatment of Enterobacteriaceae. However, during the past 10 years, carbapenem-resistant Enterobacteriaceae, or CRE, have risen. According to a report from the CDC, CRE have become resistant to most, if not all, antibiotics in use today, and is labelled as an urgent health threat. CRE have become resistant to carbapenems because of the emergence of B-lactamases. B-lactamases are generally classified into 4 groups: A, B, C, and D, according to distinguishing amino acid motifs. Vancomycin is an important alternative for use against penicillin-resistant Enterococci. During the past decade, the emergence of multi-drug-resistant and vancomycin-resistant Enterococci have limited the options available to treat Enterococci infections. VRE are not only equipped with naturally occurring antibiotic resistance, but can also obtain new resistant genes and/or mutations. With antibiotic resistance being such a substantial problem, steps must be taken now to ensure that antibiotics will remain an available treatment option for patients and to further improve the healthcare system. As for current possible options, research into new antibiotics that attack different host targets by bypassing the bacteria's resistance. We can preserve current antibiotics by having stricter guidelines in place to ensure that they are not abused and resistance is not increased. Simple steps in preventing antibiotic resistance can also be engaged. For example, increasing hygiene will decrease the occurrence of infections and therefore the demand for antibiotics. However, infections will always occur even when the utmost care is used to prevent it. Alternatives for antibiotics also need to be investigated. Vaccines provide a solid solution to antibiotic resistance, where weakened strains of antibiotic-resistant bacteria are introduced into the body, allowing the body to produce an immunological response. While these ideas have clear potential, research into these topics and extensive clinical tests need to be completed to ensure that they are safe for public use. If we continue to ignore this epidemic, the future of antibiotics will be eradicated and they will be deemed as an unavailable option.